Hi, I'm Dr. Jodie Peacock, a naturopathic doctor and Chief Medical Officer for Enhance Fertility. Thank you so much for joining me today for our topic today, which is going to be eating and supplementation to help support healthy fertility. Before we get into it, I'm just going to give you a little bit of background about myself. I was diagnosed with polycystic ovarian syndrome, or PCOS, in my early 20s. And it was while I was actually in my first year of naturopathic medical school. And so basically, with that diagnosis and with getting a bit of an understanding of the impact that PCOS could potentially have on my future fertility, I decided to really start to focus my efforts in terms of my education. And then once I graduated my clinical practice, on really helping to support women, couples through the process of fertility and also just, balancing hormonal health. I've been in clinical practice for over 13 years, and I'm also the author of a book called Preconceived, which is available either on Amazon or at our website, Enhance Fertility. I'm also the founder of the Canadian Fertility Show, and I am super happy to say I am the proud mom of 3 healthy boys, a son, and then twin boys as well, that were actually all, I was able to conceive them all naturally, which is fantastic. Now, in today's topic, what we're going to be doing is talking about some general diet recommendations that are going to be able to help support your fertility. Also, a little bit touch on kind of nutrients that have research showing to help both sperm and egg quality. This is actually, a whole other topic into of itself. And then also just when it comes to kind of supplementation, being able to get a handle on how you're going to be choosing supplements, what kind of dosing strategies you're going to be looking for, and also things that you want to be avoiding in your supplementation. So basically, our main goals when we're looking to support fertility using nutrition are optimizing 4 kind of main different parameters. One is making sure that we don't have any nutrient depletions. 2, we want to minimize any inflammatory processes in the body. 3, we want to help support proper energy production using those organelles that you remember kind of grade 10 science called your mitochondria. These are the guys that are basically in all our cells that produce our energy. And then we also want to ensure we have healthy or balanced immune function. So today we're going to, again, focus kind of more higher level on diet and nutrients, but these are all topics that are going to be really important for you to help optimize your fertility. Now, when we, again, start kind of high level in terms of our diet, we know when we're eating, we have 3 what are called macronutrients. So these are where we're getting the bulk of our calories from. And between these 3 macronutrients, carbohydrates, proteins, and fats, these are all really important for us. So any of the diets that recommend completely eliminating or significantly minimizing any one of these 3 macronutrients, we often will end up having issues with those type of diets through the long run. So we want to make sure that the diet that we are looking at and we're choosing to eat is going to be something that's long-term sustainable, and it's not going to set us up for depletions. Now, the first macronutrient we're going to touch on is carbohydrates. So one of the big things that we talk about when it comes to fertility in particular is helping to regulate our inflammatory levels. And a big part of this comes from our blood sugar regulation, or our ability to help keep those blood sugars stable throughout the day. So this kind of just gives you a glance at, when you're eating a carbohydrate, you're going to see a faster spike and a come down. Protein is going to be a little bit more sustained, and fat is going to be basically our most sustained in terms of how our impact on blood sugar is. Now, when we look at insulin is a hormone that is secreted by our pancreas, and this is the key hormone in regulating our blood sugar levels. So one of the things that happens is when we eat a carbohydrate, sugars get absorbed, they go into our bloodstream, and then our pancreas releases insulin to help keep that level stable for us. So, if we eat a high sugar meal, then we're going to have to secrete a lot of insulin to help bring that level down. Now, the unfortunate thing that we see with insulin is insulin also is very pro-inflammatory. And so this is one of the concerns that will come along with conditions such as polycystic ovarian syndrome, type 2 diabetes, where we see that we don't regulate our insulin as effectively. And basically, the less insulin that we need to secrete on a regular basis, the better that's going to be from an overall inflammatory standpoint, which is then also going to help support healthy fertility. Now, when we look at, specifically studies that look at in vitro fertilization of carbohydrates, these studies have shown a better success rate when women are eating a lower carbohydrate and higher protein diet. Now, this does not mean we are eliminating carbohydrates. As I said at the beginning, we do not want to eliminate any of these macronutrients. What this particular study looked at was just limiting carbohydrate to less than 60% of the diet. So it was not down at zero, like if you were going to do a ketogenic type diet where we're very low, basically under 60% from carbohydrate, and then having protein higher than 20% of the diet. That's what this particular study looked at. Now, we do know that embryos do have a more difficult time thriving in a high sugar environment. So this is where a lot of the recommendations you'll hear about keeping refined sugars minimized, especially when we're trying to conceive, is going to be more helpful. Now, this again is this study that looks specifically at carbohydrates in IVF. And so here they found women who ate at least 25% protein had a 64% blastocyst development. So basically that's, taking the egg and the sperm, putting them together, we create a blastocyst, versus only 33% of women in the low protein group. We also saw higher clinical pregnancy rates. And then when we did start to veer it a little bit more with carb being under about 40%, we actually saw the pregnancy rates go up to about 80, increase by about 80%. So, again, when we're looking at that plate, if we have at least 25% of our macronutrients coming from protein, and then less than 40% or around that 40% mark coming from carbohydrate, the rest being made up of fat, we are going to see better clinical outcomes. Now, when we're talking about carbohydrates, all are not considered equal. So when we're choosing, we want to be looking at natural unrefined sources as your ideal sources of your carbohydrates. So when we're looking at vegetables, these would be foods like your sweet potatoes, squashes, beets. For those people in the audience who are vegan, vegetarian, these are your lentils, your chickpeas, your beans. These are all going to be really great sources. And for those of you who are eating an omnivore type diet, these are really good foods to start to include more of. Definitely your seeds. Fruits that are lower in sugar are going to be a bit better options. So these are basically your ones that are going to have deeper colors. So your berries, your cherries, apples, pears, pomegranates, these are all going to be really good options. I have heard from some people, am I allowed to eat fruit while I'm trying to get pregnant? Is it bad for me? Absolutely not. Yes, you can eat fruit. We just want to, again, keep portions in check. So we're not going to be eating 8 fruits every day, but definitely, 3 to 4 servings is going to give you a lot of antioxidant capacity and a lot of great fiber. And then when we look at grains, this can be definitely a bit of a source of contention for some people versus others. There certainly are patients that I find who tend to be more inflammatory, who tend to have more digestive concerns, who often will do better on a gluten-free diet. So gluten grains are your grains such as wheat, rye, barley, spelt, all contain gluten in them. So typically if we're unsure, I'll recommend keeping those out of the diet for a period of time to see how my patient responds. So focusing more on things like your brown rice, oats, quinoa, buckwheat, amaranth are all going to be good gluten-free options that are also unrefined sources. Now, when we look at protein, how much protein should we be eating? So this gives you just a basic calculation of kind of the low end of what you want to be consuming each day. So if you're a kind of standard 140-pound female, you want to be eating at least 70 grams of protein per day. So basically, if you kind of divide that out over 3 meals, you're roughly looking at about 20 to 25 grams of protein in each of your 3 meals per day. Now that is definitely easily attainable. You just need to put a little bit of focus into what's going into each of those meals. Now, the other thing that's going to be important for certain patients, again, particularly those that are struggling with blood sugar regulation, patients with polycystic ovarian syndrome, I often will actually recommend doing a higher dose of protein per day. And it could be anywhere from kind of 80 to 110 grams, depending on that individual patient and any other underlying concerns. Now, when we look at where our proteins are coming from, certainly there has been a big movement towards vegetarian and veganism over the last few years. So if that is a lifestyle choice you have decided to make, you just need to be a little bit more conscientious about where your protein is coming from. Because often, unfortunately, I will find patients that come in that have chosen to eat a vegan style are very protein deficient in their diet. So it's just something that you really need to focus on. So here are some examples, soybeans, lentils, black beans, all of these foods are going to be, great sources of protein. You just often will need higher amounts of these foods in our diet to hit those same amounts versus what you would be getting out of some of your animal protein sources. So for example, you need to eat a whole cup of lentils to get 18 grams of protein, where we'll see on this next slide, 3 ounces of salmon also gets you 18 grams. And a 3-ounce serving, of salmon or chicken breast is generally fairly small. So it is a little bit easier to hit those protein goals when we're getting them from animal sources. Now, the last of our macronutrients are our fats. So with fats, we have basically they're divided into 4 different types. So we have saturated fats, trans fats, monounsaturated, and polyunsaturated fats. So for quite a while, saturated fats had a really bad reputation. They were linked to cardiovascular concerns. And basically, these are fats that stay solid at room temperature. So, the fat that you'll see on meat products, for example, fats that come from dairy are saturated. So things like your milk, your ice cream, those type of fats will be more solid at room temperature. And with these type of fatty acids, we do tend to want to keep them to less than 20% of our daily fat intake. So yes, they can be there, but we don't want them to be the predominant source of fat in our diet. Where we want most of our fats to come from is the mono and the polyunsaturated fats. So these are going to be fats that are going to come from things like avocados, olives, olive oil, your different nuts and seeds. Your polyunsaturated, you will get more from things like your fish, so salmon, sardines, these type of fats. And the nice thing about the ones that are coming from fish or your omega-3 fatty acids is they actually will also help reduce inflammation in the body. So not only are they providing you a healthy fat option, they're also helping to reduce inflammation. So some of the foods that we would be, again, wanting to focus on, nuts, nut butter, seeds, avocados, eggs, fatty fish such as salmon, different types of oils, so olive oil, coconut oil, flax. These are all quite good options when it comes to getting our fats in. So basically, overall, we want our diet to be mimicking somewhat that Mediterranean style. So we want to be getting at least 5 to 8 servings of vegetables in a day. Fish and seafood, we ideally would be eating at least twice a week. And then focusing on kind of our leaner, different protein sources that are animal source. So, things like chicken, turkey, those are going to be optimal in terms of helping to, get that protein in without getting a lot of saturated fats in. And then, for dessert type things, focusing a little bit more on fruits, on natural sugars, rather than being focused on a lot of refined sugars in our diet is going to be overall a lot healthier option. Now, the other thing that's important to think about is also where are our foods coming from? So in terms of when we're looking at particularly at fertility, we know that, some of the insecticides, pesticides, things that are sprayed on our food that, we're going to have exposure to through eating these foods actually can act as reproductive toxins and cause a lot of concerns for us, especially when we're trying to get pregnant. So there is an association in the United States called the Environmental Working Group, or EWG. You see at the top of both of these slides here. And the Environmental Working Group publishes every year a list of what they call the Clean 15, as well as a list of what they call the Dirty Dozen. So on the Dirty Dozen, these are basically the 12 kind of more toxic fruits or vegetables that you might be purchasing at the grocery store. Your Clean 15 are, again, like essentially kind of the cleanest options, where if you are not able to purchase organic or from a farm source where their farming practices, these are ones that you're going to want to stick to more. With the Dirty Dozen, I do recommend patients try as much as possible to keep those fruits and vegetables organic in their diet, so we can avoid this concern around like reproductive and endocrine disrupting toxins. When we're looking at fish, definitely there is some concern with toxicity with certain types of fish. Seafoodwatch.org is a great website to help navigate this. They basically update once a quarter and look at basically all fish populations and sources through the eastern western seaboards of North America. So this particular list was basically published to show these are ones that are very low in terms of their toxicity potential. But this is a great thing to go and check out before you start incorporating a lot more fish in your diet if you aren't already. Now, when we look at supplementation, again, when we started at the beginning, I said, what are some of the things that we want to look for before we start taking supplements? So one of the first things you want to look at is how easily absorbed are the nutrients from the supplement you're taking. So the delivery method is really important. Vegetarian capsules or liquids are typically the easiest for your digestive system to break down and actually absorb nutrients from. When we start getting into things like hard packed tablets, it can be a little bit more challenging for our stomachs to break those down and for us to actually absorb the nutrients out of them. We also want to make sure that there aren't things in them like different fillers, dyes. Sometimes we'll see red dye number 40, yellow dyes, blue dyes. They're covered in a shellac or a glaze. These are things that you really don't need from a nutritional standpoint. So it's better to choose supplements that aren't going to have these ingredients within them. Then the other piece that I do really highly encourage you to look at is whether or not, the company that you're purchasing supplements from is able to stand behind their products with a certificate of analysis. So basically, there are a good number of companies that will send their products out for third-party lab analysis before they put them on the market for sale to make sure, that the nutrients are in the forms that they're stating, that they're at the correct dosing, and then also that there aren't any things in that product that shouldn't be there. So microbes, molds, toxic metals, things like this. So it is great to work with a company that you feel really confident does this well. Now, when we look at kind of, again, general recommendations around fertility, there are certain nutrients that we really want to make sure are at good or optimal levels before going into a pregnancy. So some of these will include things like B12, folate, calcium, magnesium. Iron is more focused for the female partner. Definitely iron deficiency has been linked to earlier miscarriages or actually inability to conceive. So that's definitely an important one. Selenium, vitamin C and E, these two, as well as zinc, have quite a lot of research around helping with sperm health. as well as with egg quality. And then with vitamin D, there has been multiple studies published showing that women who are deficient in vitamin D also will have lower pregnancy rates. So this is something that you can run a simple blood test to check out to see if you're in a good range. Now, when we're looking at our prenatal formulations, when we look at these particular nutrients that I just talked about, we will find that there are forms that are more easily absorbed by our body and forms that are not as easily utilized or absorbed. So here's a quick kind of chart that helps you navigate that a little bit. So when we're looking at something like calcium, a calcium carbonate is something that, you know, would be in a product such as a Tums, something that's going to help neutralize stomach acid, but isn't necessarily going to get good absorption, you know, into our bloodstream and then, you know, into our bones where we need it. Zinc is another one that we definitely will see differences in its ability to be absorbed. Folic or folic acid, this is a big hot button one, especially in the fertility population. There basically is a gene that codes for your ability to take the synthetic form of folate, which is called folic acid, and being able to convert it into its active form, which is called 5-methyl tetrahydrofolate or 5-MTHFR. There is a subset of the population, it looks like it's around 15 to 20% of the population that is very ineffective at making this conversion. So these patients are at a very significant increased risk of having recurrent miscarriages, neural tube defects, all of those concerns that we talk about that are associated with folic acid. So if you're unsure what your status is, I would highly recommend using a prenatal vitamin that does contain the active form in it. Now, the other piece that goes along with that is, you know, if you are someone that does have this deleterious gene, if you're consuming synthetic folic acid, it will actually block the methylation pathway, which is this pathway that is so important for this detoxification, for RNA replication, DNA replication. So it is, you know, and it's not just a matter of taking the active form on top of taking that synthetic form. You want to get that synthetic form out of your diet as much as possible. B12 is another one that's really important for that methylation pathway, and deficient B12 can also be extremely problematic going into a pregnancy. So here you want to be looking for a form called methylcobalamin, or potentially hydroxycobalamin is also another good form. Cyanocobalamin is not going to be absorbed as easily. Iron is a big one when it comes to a prenatal. You know, women getting constipated or feeling nauseous is the #1 reason most women will stop taking their prenatal vitamin. So typically here, if you can find a prenatal that has either a citrate form, a glycinate form. With the glycinate form, I find this one's ideal because it will not compete with your calcium citrate for absorption. So your calcium will absorb in your stomach, your iron in that glycinate form will absorb in the small intestine. So there's no competition, as both of those minerals are really important in that, you know, preconception and pregnancy phase. Ferrous fumarate, which I do see in some of the prenatals out there, does not absorb as easily. It keeps more iron in the gut, so will be more likely to cause, you know, issues like constipation, stomach irritation, that type of thing. When it comes to magnesium, magnesium is used in, you know, 300 different metabolic processes in the body. Any of the citrate, malate, glycinate forms will tend to absorb more easily and be more easily utilized in the body. Magnesium in an oxide form will tend to hold a lot more water in the bowel, so is a great option if you are really constipated, you know, to get a higher amount in, but you're not going to get as much absorption actually into your bloodstream and into your tissues. Now, when we look at vitamin D, as I mentioned kind of when we did that overview, you know, deficiency can lead to hormonal imbalances, fertility concerns. We also will see it linked to bone loss, to depression, immune deficiencies. So if you are someone who has been diagnosed with any type of autoimmune condition, vitamin D is going to be particularly important for your case. it is really important to run blood levels of vitamin D. I mean, where I live in Oakville in Canada, we typically know that, you know, through the winter months, most people are deficient in vitamin D. So the recommendation is always to supplement. But it's how much do we supplement for each individual person that I find the lab work will help us to guide. So a starting dose is typically around 2,000 IUs, but there are some patients who will need, you know, 10,000 IUs a day for 8 weeks to actually get their levels out of that suboptimal range. So working with a practitioner to have your blood levels run to get appropriate dosing is going to be really important. Now, when we look at iron, there's a few different lab levels that we want to look at when we're assessing our iron levels. So one is just a standard CBC, which is called a complete blood count. On your CBC, you're going to see something called hemoglobin. If you are, you know, completely iron deficient, your hemoglobin will actually start to drop. And when your hemoglobin drops, often it will be a lot more difficult for you to maintain a pregnancy. Then we also look at iron, and then we also look at the storage of iron known as your ferritin level. And it's that ferritin level that, you know, we would like to get into an optimal range, so typically above 50 before going into a pregnancy. Once we get pregnant, basically our blood volume has to start to increase. We almost double our blood volume during a healthy pregnancy, so we need a lot of stored iron to be able for our bodies to make those red blood cells to increase that blood volume. So we know, you know, low iron has been linked to basically the inability to ovulate. So if you can't ovulate, obviously it's going to be very difficult to get pregnant. And the absorption, as I mentioned, you know, does vary. Heme iron sources. So heme is basically the type of iron you're going to get out of your animal sources. It absorbs the most effectively. So if you are deficient, that would be something that we want to look at. If you are a vegan or vegetarian, typically you're not going to want a heme source as it is animal derived. And this is where the amino acid chelates, such as the iron glycinate that I mentioned earlier, come into play. They have a very high absorbability, not quite as high as the heme iron, but have, you know, generally a very low side effect profile. And then also, you know, if it's in part of your prenatal, you're avoiding that calcium competition for absorption. Now, another thing that's going to be important, again, when we talked about diet, was getting more fish in. Now, typically in North America and most of the Western world, often people are deficient in their omega-3 fatty acids. And omega-3s are really important to help with sperm production. They play a big role in blood flow to the uterus. They play a role in helping with cervical mucus. So, you know, that ovulatory mucus that you will get that's kind of stringy and looks like egg white. If you're deficient in omega-3s, often you won't see that as much. And in terms of diet, we're getting our omega-3s. Flax seeds is one source. Human conversion of flax seeds is quite poor, so this isn't generally where I will recommend, you know, making our main source. Seaweed and fish are also, you know, our main dietary sources. And optimally, we want to be getting about 2 grams of combined EPA and DHA into our diet, either through supplementation or food sources every day. Now, when we look at omega-6 fatty acids, so, you know, your fish are where you're getting your omega-3s. Your omega-6s are going to come from oils such as borage oil, evening primrose oil. We will also be getting some omega-6s from food sources like flax, pumpkin seeds, sunflower seeds. And omega-6 fatty acids are going to be really important for supporting the luteal phase, or basically the second half of your menstrual cycle. So the first half is our follicular phase, which is kind of our growing phase. This is when, you know, our egg is developing, you ovulate, it releases, and that luteal phase is when we would see implantation if a pregnancy was going to happen. So during that second half, progesterone is a really important hormone, and making sure you have enough omega-6 fatty acids in your diet is going to allow your body to actually be able to make that progesterone. Now, there are a few other nutrients that we will talk about that wouldn't kind of be within your prenatal vitamin. Coenzyme Q10 and L-carnitine or acetyl L-carnitine, these two nutrients both play a really important role when it comes to your mitochondria. Now, as I kind of mentioned very briefly at the beginning, your mitochondria are found within all of the cells in our body, and these are the guys that produce energy. This particular energy is going to be particularly important when it comes to both the health of the egg and the sperm. Both of these gametes need a high level of energy to be able to replicate. Sperm need enough mitochondria, energy for mitochondria to be able to swim effectively to meet the egg. So these two nutrients basically, have quite a lot of research when it comes to both egg and sperm quality and being able to help support that mitochondrial function. So we know that low CoQ10 can contribute to some of the age-associated egg defects or deficiencies that we're going to see. And so definitely if you're someone who is over the age of 35, we want to be making sure that we're supporting that mitochondria because we can see it start to drop. A typical starting dose of CoQ10 is around 100 milligrams twice a day, and this would be both for the female and male partner. Now, what carnitine does is it basically helps mitochondrial function by it basically acts as a shuttle and moves the fatty acids into the mitochondria. So if you're deficient in carnitine, even if you're taking CoQ10, it often won't actually even get into the mitochondria where we want it to do its work. So carnitine does come from only animal sources. So again, if you are vegan or vegetarian, you may be deficient in carnitine. And again, if we're trying to optimize that mitochondrial function, even if you are eating meat sources, sometimes we do need to supplement higher levels to make sure that we're getting enough for that shuttle to work properly. N-acetylcysteine is also a nutrient that has some really great research around both egg and sperm quality. NAC is an amino acid, so basically it's a protein building block. It's a really important precursor for your liver to make one of our most potent antioxidants called glutathione. Glutathione is what then helps with basically any potential oxidative damage, and this plays a huge role when we're looking at, again, egg quality or sperm health. In one particular study looking at women with polycystic ovarian syndrome who were undergoing an ICSI procedure, they found that NAC worked comparably to a drug called metformin to help with the egg quality leading up to it. We also can see that the NAC group in this particular study that was going into this IVF clinic, we saw less immature or abnormal oocytes and a higher number of good quality embryos compared to placebo. And so in this particular study, researchers actually said NAC was a viable alternative to metformin for women. There are also studies that look at combining N-acetylcysteine with L-carnitine, and again, seeing improved egg quality, seeing less DNA damage. And typical dosing with NAC is anywhere from 500 to 1800 milligrams per day. And then the last nutrient that I was going to talk about today is myonosatol. So myonosatol is kind of a pseudo B vitamin. It is really important for development of maturing eggs. We actually see it concentrate in the follicular fluid, which is the fluid that surrounds the developing egg. It plays a really important role in egg fertilization and as well in implantation. And so studies that have been done looking at women who had a previous history of poor egg quality or failed IVF procedures found that with the addition of myonosatol, they had an improved number of good quality eggs, an improved number of grade A eggs, and an increased clinical pregnancy rate. So because it is such a safe nutrient, this is definitely something that you might want to consider adding into your regime. Vitamin C and E are both antioxidants that help in terms of dealing with any free radical or potential damage. And again, they can concentrate in follicular fluid. Normally these are going to be present in your prenatal, but also eating a diet that's rich in fruits and vegetables. Your vitamin E is going to come more from your fat sources. It is a fat soluble nutrient, so your eggs are a really great source. Different nuts and seeds are where you're going to be getting that from your diet. Avocados, vegetable oils. And vitamin E is also really helpful for encouraging blood flow to the uterus. So if you have ever had a comment that you have a thin uterine lining, or if you find that your period is, quite short and you're not getting a lot of flow, this can sometimes be an indicator that you don't have a thick enough endometrium to maintain a healthy pregnancy. That you would need to confirm doing an ultrasound to actually visualize, what the endometrium looks like. But making sure that you have enough vitamin E in can be really helpful. So if you are interested in taking a look at the preconceived book, definitely it is available on Amazon or at our website. And if you have a chance to pop over to enhancefertility.ca, you can also subscribe to the newsletter. We are including a copy of it's about a 70-page recipe book for subscribing right now. So if that's of interest, please pop on over to the website. And if you have any questions, please feel free to drop me a line. Thank you so much.